would like to meet Dr. Imneet for a few minutes. Is she free?
Yes, let me just check for you. She's actually with patients right now, but she'll be available in 2 hours.
Oh, 2 hours. Okay, we'll be waiting then. Thank you, Ernie.
Please come in.
We've collected some questions sent by parents. Can you help us answer them?
I can answer you better. Tell me.
Okay, so we have a mom
Yeah.
who's concerned about her kid who can't stop eating too much candies. How can she regulate their sugar intake?
I would say, first of all, normally what we advise is that if we cannot just say that you can't have candies, because that's not going to work. So normally what I say is that, okay, you can reserve for a Friday afternoon, have your candies on Friday afternoon followed by proper brushing, but it can't be like the whole week through, because we have to understand that each time there is an intense sugar exposure, it leads to bacteria also coming in that site. And all that you need to form a cavity is the sugar, the bacteria, and the tooth. So when all these factors are constantly present, it's not going to help children with not having the cavities. And sometimes children are very, very not listening to parents when it directly comes from them. That's where we come in. So I would request that maybe they can book a consult and we can have a dietary guidance during the consult.
So we have another mom who has a 6-year-old daughter who has a dental fear. Any advice for them?
See, with dental fear, my take is that I like to address it. I never want to ignore the fear, because if the fear exists, it's a form of emotion. Yeah? We all are humans, we all have emotions. When fear is there, we have to rule out why, what is it coming from, because it's very delicate and it's very personal. Most of the times what I understand from the kids is it's either their past experience, or stories told by peers, stories told by parents, or just some vague information from internet. So all these factors compiled together can create the fear in child. So when they walk in, or even when I have to address it, I always ask, what's the reason behind it? And then you try to separate the current situation from the reason that existed before. Like, for example, if it is to a past experience in the dental appointment, then my take is always that don't follow the same pattern of the appointment, because if you follow the same pattern, you'll get the same result. So if the child has had fear in the last appointment, I find out what was done, how was it done, and then I would modify my treatment plan or my behavior management plan according to that situation.
And lastly, how can parents prevent their toddlers from thumb sucking?
Very nice. Okay, see, thumb sucking, I would say it looks cute and nice, probably until 1. Now, after that, it becomes a habit. And again, from neuro-linguistic programming, from NLP, what I can say is that habit has again got 2 components. It's got intention and it's got the act. We never remove the intention. It's super important. Why would a child thumb suck? Because probably it's a feeling of pleasure, safety, security, warmth, everything. So I want to keep all that in one package. The act is what is not acceptable. So I want to remove the act. So whenever we address thumb sucking, I always break the act, which means that I would give a star chart, introduce a new act, but I will take care of the intention. For example, if the child is sucking their thumb and I would replace it with a cuddle toy, I would tell the parents, today you bring them to me, I'll give them the star chart, I'm going to address the habit, I'm going to show them the videos, but tonight you're going to get them a new toy which is going to give them the same comfort.
Nice. Thank you, doctor, for your time. See you. Have a good day.
By the way, my dino goes with you, or
Oh,
does it stay back?
yeah. Sorry. I'll give it back.
I can
Thank you. See you.